So this patient's coming in. She's had a fluctuant area just off her nail that's been progressive over the course of the last few weeks. She's put on an antibiotic and it settled down a little bit, but then it sort of came back up on her. You can see this area here where it's just discolored, sort of clear, and this is, see how that's boggy? So anytime you see this, this is all infection. Well, this is just started as a paronychia, which is infection at the nail base, or extended in of itself. It's built up so much that we have to drain this. So what I'm going to do is I'm going to spray this, but usually when it gets distended like this, sensation is much less through here, and you don't even have to do a lot of freezing. I'm going to do some just topical stuff, but we should be able to get that to rupture and clear for us. This feels cold. You're okay with that? So I just use a needle because it has a nice bevel on it. And all I want to be doing is just lifting this up. So even in children you can do this because, again, there's not a lot of sensation that's there, and that's what ends up happening. As long as we can get this to release for us. You're okay?
Yes.
Now putting pressure on this does, elicit some discomfort, so you have to be aware there's going to be some of that. It's not too bad once we take the pressure down. Yep, sorry. This is certainly evacuating. There's less pressure that's there. You can see how much redundant tissue is there, that bogginess. All I'm doing there is, as I'm wiping it, because of static coefficients of friction, as the thicker material comes up, it's going to not clot itself off, it's going to wall itself off because it gets caught. So essentially I just open that back up so it has a chance to drain. And the reason why I show you this is, so the textbooks will sometimes indicate that you have to take a huge cut through all of this tissue to get it to drain. And typically you don't. Like, the area where you have less nerve supply is right, again, where it's most distended. And as long as you just give it a portal of exit, then most of it will funnel towards that portal. And there won't be need to cut into areas that are more sensitive. And as we've seen in other procedures, it doesn't take the anesthetic very well. Pretty good strain, pretty well. And you can see here that the color is different because that infection is cleared back out from that perspective. So since she's already on a bit of an antibiotic, just let her continue that for a little bit. But now that it's open, this should actually allow itself to clear. And I'll have her soak this when she gets home. Now this area that's distended, that's going to collapse back down, and some of the skin's probably going to slough off, and that's okay. But at least now it'll have a chance to go away for us. That's it.